Okay, my name is Nicole Polk, and I'm doing my presentation over equine infectious diseases. And I have a few people I want to show you. Thank you guys for coming in advance. As I said, I'm doing my presentation on equine infectious diseases. Knowing the treatment and prevention of these diseases can help benefit you and your horse. And this is a picture of a horse that's contracted West Nile virus, and he's in a sling. This is the first disease I'm going to talk about. How is it contracted? It's contracted through mosquitoes, and actually mosquitoes get it from infected birds. So it goes from birds, mosquitoes, to the horses, and we can actually contract this disease as well. What does it do to the horse? Based on Dr. Gore's book, Horse Owner's Veterinary Handbook, that was published in 2008, he describes it as multiplying very rapidly in the blood, and it affects the brain and causes severe inflammation, and it attacks the central nervous system. These are some signs and symptoms. The most prominent would be loss of coordination, fever, drowsiness, and muscle weakness and trembling. This is a horse that has contracted the virus, and as you can see, he's got a loss of coordination, and he can't stand up straight on his own. And this is due to the attack of the nervous system. How do you treat and prevent West Nile virus? Treatment includes steroids, IV therapy, and mannitol, and certain serums. The IV therapy and the mannitol are for prevention, and they help in brain inflammation. And prevention, super easy. There's an annual vaccine, and actually you can do it semi-annually, like every 4 months, and that's if you're in a high mosquito population. The next disease I'd like to talk about is tetanus. It's contracted from deep wounds, and it's caused by the bacteria Clostridium tetani, and this is a picture of it inside the body. And actually, horses are more susceptible to this disease because they have a lower natural immunity than any other domesticated animal. What does it do to the horse? Based on Heather Smith, her book, Story's Guide to Raising Horses, that was published in 2000, she states that it occurs where oxygen content is lowest, which would be where the wound was and healed over. And it's also a neurotoxin that is transferred to the central nervous system and also is transferred to the brain from the spinal cord. Signs and symptoms. The incubation period is within 1 to 3 weeks, and some signs are stiffness, spasms, especially in the legs and the muscles. Third eyelid protrudes, that's a big one, and lockjaw. This is where the term lockjaw comes in. This is a horse that has tetanus. You can see his head protruding out and his tail up. This is common to see on a horse that has tetanus, and it's called the sawhorse stance. How do you prevent and treat tetanus? Treatment, there's a surgical treatment where you can go and open up the wound, take out the dead tissue, clean it thoroughly, and then leave it open for drainage, and then inject penicillin into it. And you can also inject penicillin intravenously as well. Prevention is super easy. Just clean the wounds, make sure, even if it's a small wound, that you clean it. And just like West Nile virus, there's an annual shot that you can give to prevent it. The next disease I'd like to talk about is Lyme disease. And it's actually contracted through ticks. And based on Dr. Chang's article in Cornell University's College of Veterinary Medicine website that he published in 2014, he states that ticks actually get the disease at an immature they feed on white-footed rats or mice. And so it goes from mice to the ticks at an immature stage. And then as they mature, they tend to feed on like larger mammals such as horses. And we can actually get it as well. And it's a bacterial disease caused by the bacteria Borrelia burgdorferi. And some signs and symptoms is that it spreads really slowly. It can take weeks and more like months to even develop signs. And when you do develop signs, it's arthritis, pain, muscle swelling, joint swelling, and actually muscle deterioration. And these are actually signs that can be of injury signs, so it can go undiagnosed for a long period of time, which makes it really dangerous. This is a picture of a horse with Lyme disease. He's being treated for arthritis in his back, which is due to the disease. How do you prevent and treat the disease? Treatment includes antibiotics. That's the best treatment on the market today for this disease. And prevention is just to check your horse regularly for ticks. After a ride, check them all over just to make sure they don't have ticks on them. And using insecticides as well will help. So I covered West Nile virus, tetanus, and Lyme disease, and these are all equine infectious diseases. And the prevention and treatment of the diseases is, it can benefit you and your horse significantly. And as I mentioned earlier, as a quick note, all these diseases can be contracted by humans as well. Thanks everybody for listening.